lot of myths about brachytherapy for prostate cancer. One is that it's no longer done. But they couldn't be farther from the truth. We have a brachytherapy suite that is very active, and most of the procedures that we're doing in that suite are prostate brachytherapy. And I think the reason why that is again, because of the convenience of the treatment, the excellent outcomes that we are able to achieve, and the low side effect profile of this treatment.
I think one of the common myths or misconceptions that patients have about prostate seed brachytherapy is that they will have to avoid being around their family and friends.
I think a lot of people mistake prostate brachytherapy for radioactive therapy, and so they believe they can't be around people for a certain period of time, or they're concerned also about intimacy issues. And because of advances in the way that the radioactive sources are stranded in a ribbon, they can't move and get into the bloodstream in a way that loose seeds, which is the way that we used to do it years ago. So because it's stranded, those issues of movement or worrying about seed sources migrating are really not as important as they might have been if you're reading on the internet something 20, 25 years ago.
There have been studies performed where patients were in contact with their spouse even slept in the same bed, and yet those studies suggest that there were very low rates of any radiation exposure, and that the spouses actually would get a higher amount of radiation if they were to fly to, let's say, Tokyo and back. That's just a comparison which shows how minuscule the amount of radiation exposed to people around them is.
The only restrictions that we really have is in the first 60 days, we really want to minimize exposure to women who are pregnant or very small infants. But I know from depending on where you get your seed implant and what kind of radioactive source they're using, that may change.
One of the common myths with radiation in general is that once you have radiation, you can't do it again. Brachytherapy actually provides an opportunity at second treatment without causing major side effects. There's now procedures that I do and some of my colleagues do in which we use brachytherapy as a salvage therapy after recurrence. And early studies show that this can be done, again, within a half an hour to an hour procedure and provide a man with a second chance of cure while causing minimal side effects.
It turns out that brachytherapy has such a high local control rate that we really don't have to worry about that issue. We do with external beam radiation therapy, or SBRT commonly, we do with surgery, but when you get brachytherapy, it's very uncommon to have to go back and treat again.
Prostate brachytherapy is only for patients with low-risk disease. But that's totally not true. As a matter of fact, prostate brachytherapy's biggest advantage is when people have aggressive disease. So if someone has very aggressive disease like a Gleason score 9 or 10 cancer, which is the type of cancer that is more likely to spread and kill somebody, the largest study ever published, 1,800 patients from 12 major academic centers, showed that the patients that got external beam plus brachytherapy had a dramatically better overall survival, dramatically better prostate cancer-specific survival, so less likely to die of prostate cancer, and a dramatically lower risk of the cancer spreading to the bones compared to either surgery or external beam and hormone therapy. So yes, it can be used for low-risk disease. And I published a paper showing a 99% success rate with low-risk disease, by surgery is 90% or so. Intermediate risk disease is around 90 to 95% success rate. Surgery or external beam, you're talking about 70 to 80% success rate. And for a high-risk disease, you still got 85% success rate with brachytherapy, while the external beam or surgical success rates are down more like 60 to 50%. So all disease stages that are localized, low, intermediate, or high risk, brachytherapy has a higher cure rate.
Patients come in often wondering if they're just a candidate for brachytherapy, and sometimes they don't realize that they are, and most men are a candidate for brachytherapy. In fact, it has the biggest breadth of data that we know of. It's the most robust. We know brachytherapy to have the most durability. It has the highest local control rate long term. It really minimizes the exposure of the body to radiation. So that's often what we have to educate patients on. And then also there's always this concern, well, can radiation cause cancer? And it turns out with brachytherapy, it minimizes that risk as well.